this video, we're going to be working through an activity. Imagine you're the medical receptionist in a busy sports injury clinic. Sarah Gray is a new patient. She's just arrived for her appointment. You get her to complete a medical history form and then send her through to see the doctor. After the consultation has finished, the doctor asks you to type up his handwritten notes. Let's have a look at the medical history form Sarah completed. Each surgery and practice will have a different form. For this one, it's specific to sports injuries. You should check where you work which form is to be used and if there are different forms for different patients or doctors. Most forms will contain personal details such as name, address, contact details of an emergency person, and their healthcare details such as other doctors and Medicare numbers. Should also address any medical concerns such as allergies, medical conditions, or medications. In Sarah's form, we can see that she's got a twisted right ankle that she did at netball. She's also allergic to penicillin and has asthma when she exercises. Now let's have a look at the doctor's notes. It's important that we understand common abbreviations when reviewing doctor's notes. As you can see here, there are a number of common abbreviations used. PH for patient history. You can see that the doctor has spoken to Sarah and made a note of some of her history, her age, her medical status, her allergy, and her current vital signs. VS for vital signs, and then BP indicates her blood pressure, which is 125/81. Her heart rate is 85 beats per minute, and her temperature is 37.01 degrees Celsius. SX means symptoms. This is why Sarah has come to see the doctor. Sarah has told the doctor that she has right ankle injury from playing netball and that she received the injury 48 hours ago. Lat hyperextension on landing tells us that she has a lateral or outside hyperextension, which means overextension, when she landed. There was pain, swelling, and bruising. RX tells us that she has had some treatment, ice and Panadol. She has also said that she has limited the movement and limited the weight bearing. OE, or on examination, tells us that she's getting some pain when she rotates externally. That means when she twists her ankle outwards. DX, or diagnosis, says that there is a right grade 2 ligament sprain. The treatment the doctor has recommended is ice, PWB, we'll get to that in a minute, and to return in 48 hours. We've covered most of the common abbreviations. Now let's have a look at some of the less common ones. In the last slide, we looked at some of the more common abbreviations. You may have noticed we've skipped over a few of the less common ones. Now you should pause this video and use your glossary. You need to look up the following terms: BA, MCG, NBI, PWB, and FU. Remember to take the terms in context if they have more than one meaning in your glossary. Once you have found out what BA stands for, you should use your suffix, prefix, and root word glossary to figure out what it means. Welcome back. Hopefully by now you've managed to look up those abbreviations. BA stands for bronchial asthma. MCG means micrograms. NBI means no bone injury. PWB, partial weight bearing. And FU for follow-up. Let's have a look at the term bronchial asthma. We know from using our glossary that asthmat or asthmato means gasping or choking. Bronchi refers to the bronchial tube, and the suffix al means pertaining to. So BA stands for bronchial asthma, which means gasping or choking pertaining to the bronchial tube. So now we've figured out all of the abbreviations in the doctor's notes. Is there anything else we need to know? Is there anything else you weren't sure of? It is always important when working with medical terminology. If there is anything you're not sure of, ask. We can't say this enough. If there is anything on the notes you don't know, ask, ask, ask. Within the notes under patient history, doctor refers to exercise BA, which we now know as bronchial asthma. RX means treatment, and the word albuterol, 180 micrograms. We can use some clues to decipher what albuterol might be. RX is treatment, so it's probably some form of treatment or medication. Remember back in the patient history form? Sarah told us that she had asthma when I exercise, and she uses Ventolin before I exercise. Albuterol is an asthma medication taken through an inhaler. Its medical term, albuterol, or common term, Ventolin. Remember, you can use some clues to decipher and even write up your notes, but before you finish, make sure you check. So let's look at the final result. Here are Sarah Gray's final typed up notes from the visit with the doctor. When you're typing up the notes, there are a few points to remember. Firstly, take your time. It might be busy, but rushing your work may result in mistakes. Make sure your spelling is correct and that what you're typing up is the same as what the doctor has written. Proofread your written work. Make sure you always ask for clarification from your practice manager or the medical professional if you're unsure of anything. This doesn't just apply to the content of the notes, but also how to format them. And always, without fail, get the medical professional to review your final documentation and verify it is correct and accurate.